Now, the first topic in the superficial infections, the name of this infection is Tinea or Pityriasis versicolor. So, this disease or infection, it is caused by one fungus, and this fungus happens to be known by the name of Malassezia furfur or globosa. So technically there are two species, Malassezia furfur and Malassezia globosa. Okay. Next, how does this disease present? You got to remember that this disease, the clinical feature is hypopigmented patches, on the skin. Obviously, we are talking about cutaneous infections, so they will definitely involve the skin. Next, what are we going to do for the diagnosis? Obviously, we should take the sample as skin scrapings. Okay, we will take skin scrapings as the sample. And once we have collected the skin scrapings, you can actually do two things with this. One thing is the wood lamp examination. Okay, you might have heard about this test, wood lamp examination. So this wood lamp exam is done under the presence of UV light. All right. Next, what else can I do with this? I can actually use 10% potassium hydroxide. Okay. So second thing I'm able to use here, it is called as 10% potassium hydroxide. Fine. Next, you must remember that on this things, whatever you're using, you're going to actually appreciate one appearance that makes us identify this organism. And that appearance is quite famously called spaghetti and meatball appearance. Okay. Spaghetti and meatball appearance. Or another word to describe the same, it's also called as banana and grape-like appearance. Okay, so this would be seen on the microscopic picture. Last and the final, if you grow it on the culture media, okay, assuming you've grown it on the culture media like SDA, you will be seeing fried egg colonies. Okay, fried egg colonies. That's it that you got to remember about this organism. See, I hope you guys are able to very clearly see that there are patches appearing on the skin, and this is the way your Tinea versicolor is going to look like. We have just mentioned that we get to see these things called as spaghetti and meatball or banana or grape appearance. See, this rounded things obviously are described like grapes or the meatballs. Same thing you can see in this KOH mound also. How does it look like? And this noodle-like structures are described like spaghetti. So spaghetti and meatball appearance. Okay, so the next type of tinea, as you can see, it's called by the name of Tinea nigra. And this infection, it is caused by one fungus, which goes by the name of Exophiala, which is also known as Horte wernickeii. Okay, this is the name of this fungus. Now, how exactly does it present? Let's have a look. The clinical feature of this disease is it causes lesions on palms and soles. Okay, it causes lesions on palms and soles. That is the presentation of Tinea nigra. Next is an infection called as Piedra. So what exactly is Piedra? Let's have a look. Piedra basically is a lesion of hair shaft. Okay, it is a lesion of hair shaft. There are two types of Piedra that we can actually see in our practice. One of it's called as white Piedra, which is caused by one fungus, and then there is another one that is black Piedra, obviously caused by another fungus. Okay, now when you talk about the white Piedra, the organism that is causing this, it is caused by one organism known as Trichosporon bigelii. Okay. Next, the black one, it is caused by another fungus called Piedra horte. Now in this topic, they're not going to test you much. So all you got to know is where do they cause lesions, what are they, and the names of the fungus. Okay, let me give you a way to remember this easily. See, number one, you all might understand the word nigra means black. And you must remember, whenever we wear black, we end up looking hot. Okay, so horte. Okay, just like we say hottie, right? So just like that, horte. Same thing. If you see here black, once again, you're able to see the word horte here also. Okay, so you're sorted with this. Now, if you want a mnemonic even for the white one, we can remember when there are thunderstorms and you see lightning that time, what's the color of lightning? It is white. And I hope you remember that the lightning is called as bijli. Okay, we can simply remember it like that. See, I hope you guys very easily recognize that this is none other than your Tinea nigra. As we said, this presents as lesions on palms and soles. Next, this what you're looking at is the infection called Piedra. I told you there are two types. One is white, another is black. The first one on the top is the black Piedra, and the next one is the white Piedra. All right, so in this next part of the lecture, we're going to talk about these infections called as Tinea infections, which also happens to be known as dermatophytes, or also called as ringworm infections. So typically, these are divided into three main varieties. The first one called Trichophyton, another one is Epidermophyton, and the third one is Microsporum. So these are the three types of fungi. And obviously, when the name says derma, we all can analyze something that the skin has to be involved. And for that reason, I've put skin everywhere. Like in all the three, skin is involved. Then why are they named so differently? Because of the extra tissues that they may involve. See, if you notice the word Trichophyton, you get to see the word tri in here. So we're going to remember the word tri means three tissues are involved. First one being the skin. The next one are the nails. And then finally, what we have is hair. Okay, so three different things are involved here. Next, you got to remember that if you're talking about Epidermophyton, we may remember the word epiderm. Epiderm means outer layer, and you can remember skin and nails are involved in here. See, don't get me wrong, I'm not saying that nails come under epidermis layer. I'm just saying to remember this easily. Guys, we need to just quote that one mark, right? By hook or crook. It doesn't matter how you remember it. So that's why I'm just giving you a hint. Remember, epiderm means outer layer, skin and nails are involved. So we just left out with one, combination, that is skin and the hair. So what you do is just memorize the first two. The third one will automatically come to you. All right. Now, based on their clinical presentations, these tinea infections have been given some names like Tinea capitis, Tinea barbae, etc., etc. So guys, Tinea capitis, this is the one that is involving the scalp. So basically it involves our head, right? So this is your Tinea capitis. This is broadly divided into two types. So what are the two types of tinea? Let's have a look here. See, one of them happens to be known by the name of favus. Okay, it's called by the name of favus. This is the first thing. Now, in the favus, I would like all of you to remember the S, that's where it ends. And let's remember, the lesions in this, they look scaly, meaning they kind of looks like psoriasis. All right, they look like that. So scaly lesions, or we can also describe them to be crusty lesions. So scaly or crusty lesions are a feature of favus. And another reason why I made you highlight that word there is it is caused by one fungus which is called as Schonlein. Okay, it's caused by Schonlein. So technically the triple S here, favus, S for psoriasis like scaly lesions, and then Schonlein is the organism causing this. Next type of infection of the scalp, it goes by the name of chirion. Okay, the next one we are calling it as chirion. So when we are talking about chirion, how is this guy different? Please remember, it presents as a boggy swelling. Okay, so this one is scaly in nature and this one is a swelling in nature. These two are different. Okay, and who causes this? Then you got to remember that there is somebody called Trichophyton mentagrophytes. Okay, Trichophyton mentagrophytes. This is the name of this fungus, or another name, Trichophyton verrucosum. Okay, so this chirion is caused by these fungi, right? These are quite serious infections of your scalp. Now, first thing is we got to remember the word capitis itself, right? That it involves the scalp. What we can do is we can remember that we wear cap on the head. Yes or no? We wear cap on the head. That means this is the infection of your head, that is scalp. Next, I gave you some mnemonics like favus, how to remember. Sir, next thing, Tinea barbae. We all go to the barbers either for a haircut or probably for lining up the beard. Yes or no? So same thing here, barber's word is here. So we can remember that this involves the beard part. Okay, this involves the beard. And that's why it may be known as barber's itch. Next one is Tinea unguum. I pronounce and remember it like ungli, right? Ungli. Ungli in Hindi means as fingers. So this is the guy that involves the fingers. Done. Next is Tinea pedis. This Tinea pedis is involving your foot. And for that reason, it has gotten a name called as athlete's foot. Okay, see, try and understand this basic concept. Fungi love moist environment for their growth. So whenever we are active physically, obviously we will sweat, and this sweat provides the moist environment for the growth of these fungi. That's why you can expect this kind of infections. Same thing in our groin area also, the sweat starts to collect. So that is the next name called Tinea cruris, which happens to be known as jock itch. Okay, so the next word is jock itch. This is something you need to remember, guys. Okay. Now these two things, what I just mentioned, that is Tinea pedis and Tinea cruris, they're actually caused by the fungus like Epidermophyton flocosum and Trichophyton rubrum. Okay. Next, let's try and remember, like, who are the most common organisms who cause these infections. See, it's not going to be any new names. They are the same names that we have just learned a while ago. So they're going to be Trichophyton rubrum or Mentagrophytes. Okay, obviously they're not the same. They're two different organisms. They are generally the organisms who end up causing this Tinea infections. All right. Next, since there are two different organisms who are causing this, there are tests to differentiate them. Okay. So what are these tests? Let's try to understand and remember them. See, one is called hair perforation test. Another is called as urease test. See, you have to remember that both of these tests are positive with Mentagrophytes and they are negative with rubrum. Okay, I hope you guys got this. Both these tests are positive with Mentagrophytes. Fine. Next part is the diagnosis. Now imagine we have prepared a slide from using this stain called LPCB we talked about earlier. What we will be doing now is actually look at certain structures in these organisms and figure out which organism is which. Now you might be able to see there are two structures I'm going to talk about here. One thing is called as microconidia. Micro means something very small. So that's why instead of looking at their shape because it's difficult, we look at their numbers. And when you talk about macroconidia, macro means what? Macro means big. Macro means big. So this is where we are going to look at their shapes. Okay. Now let's start with the first guy called Trichophyton. In the Trichophyton, these microconidae are quite a lot in number. That means they are abundant. They are abundant. Next, in Epidermophyton, they are completely absent only, and there are quite a few in the microspore. Okay. Next is macroconidia. This is quite high yield. They love to ask this. You got to know that the shape of the macroconidia, it is going to be pencil shaped. It's going to be pencil shaped when it comes to Trichophyton. Next, if you talk about Epidermophyton, it is going to be club shaped. And finally speaking, Microsporum, it is spindle shaped. Usually speaking, 90% of the time, if they're asking you the diagnostics from here, they love to ask the shapes of this. They may give you the image and ask you the organism like that. So you got to know this. See, what exactly are we going to do to remember these things? Please try to remember it like this. When you look at the word Trichophyton, just highlight the word tri. Earlier also we used the same word, right? Now let's highlight the first thing in this, the shape. Now we get a word called trip. Next is this thing, Epidermophyton, it is club shaped. So now So now combine this, we get the word epic trip. Okay, so imagine you went on a trip or something and that was awesome, so you're going to say that trip was epic. Okay, there are two types of trips, as you know. I hope you're not going on the other trips that I'm talking about. So anyway, epic trip is the mnemonic. Treatment, when you talk about, we're going to use a drug called terbinafine, and if it's Tinea capitis infection, then we use a drug called griseofulvin. I believe you're able to understand that the first picture is happening in the groin area. That is what is known as Tinea cruris or jaw itch. The second picture, which is seen near the mustache, has to be Tinea barbae. And the last one is on the feet, so it's Tinea pedis. Fine. Next thing, sir. Moving further, these are the two infections that you get to see on the scalp. First of all, why don't you guys recall? Do you remember the two names that we talked about? One was called as Favus, another was called as Kirion. So obviously, ladies and gentlemen, the picture that looks like scales on your head is Favus, and this swelling, boggy swelling, is called as Kirion. Okay, next. Let's look at this picture and identify what this is. Guys, in this picture, you are able to see both microconidae and macroconidae. These are all microconidae, and there are quite a lot in this picture. Abundant microconidae and pencil-shaped macroconidae. This is a classical feature of the guy called trichophyton, right? So this picture is trichophyton, my friends. Next thing is this picture. I hope you're able to understand that only some shape structures are visible here. You're not seeing those dot-like structures, meaning microconidae are absent. If microconidae are absent and you're just seeing these things club-shaped, they're looking like clubs, right? So club-shaped macroconidae, it's a feature of epidermophyton. Next picture is this one, sir. What are you able to see? You're seeing spindle-shaped, right? You're seeing spindle-shaped macroconidae, and you're seeing relatively less amount of microconidae. This is a feature of microsporum. Okay, so this discussion of pictures here winds up the topic of Tinea altogether. सर जी यहाँ पर इस टॉपिक को कट कर देना है. जो अब मैंने आज जो लेक्चर स्टार्ट किया था ना, वहाँ पर फंगल इन्फेक्शन जहाँ पर लिखा हुआ है वहाँ से लेके यहाँ तक एक टॉपिक बना देना है वीडियो में.